Alopecia, treatment. What is this hair loss? Sudden or progressive hair loss, medically called alopecia, is often a source of concern. What causes? What to do in case of alopecia? How to do the pull test? What to eat? All human beings lose their hair in their lifetime. This is a normal process. Hair capital decreases throughout life. Thus, a 60-year-old woman has half the hair she had at the age of 15. A hair does not live the whole life of the individual, but it has a life cycle of 5 years, after which he dies and falls. Each hair follicle has up to 20 hair cycles. It is therefore not necessary to worry too much about a hair that falls. It will most of the time be replaced. During life, 20 to 30 hair cycles follow one another. Each cycle consists of 3 phases. First phase, the hair grows. During the anagen phase, the hair is in a period of growth. On average, they grow 1 centimeter per month. But there are variations depending on gender. Women's hair grows a little faster than men's, or season hair grows faster in summer than in winter. The duration of the anagen phase also varies with gender. It lasts 4 to 6 years in women, compared to 2 to 4 years in men. Second phase. The hair stops growing. During the catagen phase, which lasts 3 weeks, the hair stops growing. Indeed, the hair follicle that surrounds and nourishes the hair root is no longer active. Third phase. The hair falls. During the telogen phase, the hair in the growth stage will gradually push towards the surface of the scalp, the hair whose growth has stopped. Thus, dead hair is replaced by new hair. This phase of hair loss lasts 1 to 3 months. The number of hairs that grow is always much higher than the number of hairs that fall out. At any time, about 80 to 85% of our hair is in the anagen phase, 1 to 2% is in the catagen phase, and 15 to 20% is in telogen phase. What is alopecia? Sometimes, hair loss accelerates and is no longer compensated by proportional regrowth. This is called alopecia, because the hair becomes abnormally thinner. It is estimated that a loss of more than 100 hairs per day over a long period, several months, is an abnormal loss. What is androgenetic alopecia? Baldness is a form of alopecia called androgenetic. It is localized on the forehead in men and more diffuse in women. Contrary to seasonal falls, which are brutal, these alopecias are progressive. The causes are both hereditary and hormonal. Thus, as some hair is abnormally sensitive to male hormones, it renews itself more and more rapidly and the phases of hair loss accelerate. We speak more often of male alopecia. How to do the pull test? A simple test allows you to know if the hair loss is indeed abnormal, the pull test. You have to run 2 hands through the hair, spreading your fingers like a large comb. If, in total, more than 20 hairs remain between the fingers, the level of loss is abnormal. What are the causes of alopecia? Fall and spring are good times for hair loss. All hairy animals, including humans, molt at the start and end of winter. In September-October, many people come for consultation because they are worried about hair loss. However, it is completely normal at this time of year, but the lack of morale, which sets in during the transition to the bad season, increases the concern, reassures Dr. Regan. An overly strict diet can also be the cause of alopecia. The tissues of the body that renew themselves the fastest are the most impacted by such a diet. However, hair renews itself very quickly. These diets can lead to deficiencies, themselves responsible for an acceleration of hair loss: zinc deficiency, magnesium deficiency, calcium deficiency, and especially iron deficiency. Stress and depression are another possible cause of alopecia. They can be the cause of alopecia areata, which is a particular form of hair loss, or of whitening of the hair, because white hair falls out last. Hair turned white the day before her execution. Other causes of alopecia areata exist, especially in the case of dental problems. The fact of having undergone general anesthesia is another factor of alopecia. The products being toxic for the root, the hair dies and then falls out. But in general, the hair ends up growing back. During pregnancy, female sex hormones estrogen and progesterone increase. The hair is protected and in good shape. But after childbirth, it's the opposite, the hormone level drops. The growth phase is stopped, a large number of hairs pass into the catagen phase, then into the telogen phase. As a result, 3 months later, women notice that their hair is falling out. When there is an imbalance between female and male hormones, we can observe an acceleration of hair loss, comments Dr. Regan. Dysfunctions of the ovaries or the adrenal glands are also part of the identified factors. Menopause.